So genetics actually has an impact in making diagnosis in lots of different areas of endocrinology. My particular areas of interest are growth disorders and obesity. So for growth disorders, it turns out that if you look at children who have severe short stature, a substantial fraction of them, something like a quarter or a third maybe, actually have a single gene disorder that's responsible for their short stature. And that's much higher than we would have suspected going in. And including some syndromes that people know about but are easy to miss because they can present just like garden variety short stature. And then sometimes the syndromes that are so rare that it's actually difficult to even think of them. Short term, really that's an immediate impact for the patient, and most of the impact there is if you can make a genetic diagnosis that wasn't actually suspected beforehand. And that can have an impact for a patient. Occasionally can actually change the way you would treat them, can have implications for family members, but oftentimes it can make a diagnosis which in and of itself can be of great value to a patient. Sometimes they've been on a diagnostic odyssey of years of testing trying to figure out what's going on, and this can give them an answer. Right, so what we hope is that just raising the awareness that even though rare disorders are individually very rare, collectively they're actually not that rare. So that, you know, most people who are taking care of a common disease, hidden in there will be a few patients who actually have a rare, much more purely genetic form of that disorder, and that can make a difference for those patients. At least for our experience with short stature, the two most common diagnoses that seem to be underdiagnosed, one is Noonan syndrome, which actually most pediatric endocrinologists know is underdiagnosed. It can have a very variable presentation. Sometimes it's really easy to recognize and it's diagnosed, you know, when the child is very young. And sometimes it's really only diagnosed when somebody thinks of it much later, when something else happens. And that can be important, A, because it provides an answer, and B, sometimes there can be some cardiac issues that may have gone unrecognized that go along with Noonan syndrome, and so screening for those becomes more important. And there are also features of delayed puberty, which can be very severely delayed in the setting of Noonan syndrome, and again, it can provide an explanation for what's going on that can be a relief to the family. So obesity, there's less known, I would say, about what the rare forms are. It's probably a smaller fraction, certainly if you take adults with obesity, until you get to the very severe end, you know, it's probably a smaller fraction. But even in adults, in the severe end, so for example, patients who are going to get bariatric surgery, probably 1 or 2% of them have a mutation in a gene called MC4R, which is the melanocortin-4 receptor. And we don't yet know if that has implications for therapy. It's too new yet, but there are specific treatments that target the receptor that's changed, that's mutated in those patients. And we don't yet know whether those therapies work better in those patients or worse in those patients or about the same. But until we actually find out who those patients are, it's actually difficult to do that sort of work.